Well, another breaking story for you. The morning's figures have been released showing that the NHS had its busiest year on record for emergency services. Comes as flu continues to pile pressure on hospitals into this year. Well, the latest statistics say there were 8.9 million incidents handled by ambulance teams in England overall last year, up from a total of 8.35 the year before. The total number of A&E attendances in 2024 hit 27.4 million. In December alone, there was 2.35. Well, pressure is still being piled onto the wider NHS. Last week, there was an average of 5,407 patients a day in hospital with flu. That's 3.5 times higher than the figure last year. Well, let's speak with the Chief Executive of the Royal Berkshire Hospital now, Steve McManus. Steve, appreciate you making time for us here on Sky News. We've just there talked about the national picture. It varies hospital by hospital. If you were to take us into your A&E, your wards, what does it look like?
So I think it follows the national picture. We're under significant amount of pressure and have been over the last period. Partly, we entered into the Christmas period instead of having reduced levels of bed occupancy because of the issue with flu and other seasonal viruses. We had a high level of bed occupancy as we went through Christmas and into the new year, and that's been compounded in certainly this first week of January, where we've seen that sustained level of demand and the sustained level in terms of flu cases needing to be treated here at the Royal Berks.
You talk about the significant pressure. Are you managing to cope with that pressure?
So really proud of the teams here, the clinical staff, the management staff, in terms of what they're doing every single day to try and manage that demand and manage that pressure. It is really, really challenging. However, because of a number of things that we've been able to put in place over the last 12 months, which looks at other pathways for same-day care here at the hospital, but also with our partners in primary care and community services, we are managing to try and provide a safe service as much as we can, but we recognise that the experience at times for our patients and for our staff is not where we need it to be.
We can see the ambulances behind you, lots of focus as ever, especially this time of year, on A&E. What roughly are you looking at with regards to ambulance wait times, A&E wait times at the moment?
So certainly at the beginning of this week, a significant proportion of our ambulances arriving, around 100 and 120 ambulances a day. Around 40 of those ambulances at the beginning of the week on Monday were delayed by more than an hour. And in one case, it was up to 7 hours in terms of being able to get the patient into the emergency department. I'm really pleased to say, because of the sort of joint work over the last couple of days from our teams, we've seen that dramatically reduce. And yesterday we only had 2 ambulances that were delayed more than 60 minutes. So because of the hard work collectively, we are seeing a slight improvement, but I wouldn't underestimate the continued demand and challenge that we're seeing, particularly as we know that we are not out of the peak period around flu at the moment and other seasonal viruses.
What do you need to help you and to help your colleagues?
We really need our communities to continue to look at other opportunities of receiving some of that same-day care, whether it's within our primary care services or community pharmacy, or using NHS 111 or NHS 111 online. So there are different ways of accessing same-day care. Also, really, again, considering whether or not you need to be in an emergency department, because it is there for accidents and emergencies. So really looking at other alternatives. And as a community, looking out for some of those vulnerable members of our community, neighbours and others that we may need to try and support in a way that avoids them deteriorating to the point that they may need to come to an emergency department like ours here.
That's what you need from the community. In the last few moments, politicians have been debating in Parliament with regards to the state of the public finances. What do you need from the government in terms of financial support, economic support, practical support?
So I think a continued recognition of some of the challenges that we have. We talk about sort of productivity within the NHS. Actually, a recent kind of study actually indicated that the amount of inpatient beds that we have within the NHS is one of the lowest here within Europe. So we use those beds really effectively. So a recognition about that particular position, but also that we have got sustained longer-term plans, whether it's for a non-elective and emergency care or for our planned care, that we're able to enact with confidence over the coming kind of period. So being able to sort of plan ahead for next winter already and get that balance between emergency care and our elective care is going to be really, really important so the NHS can forward plan.
Chief Executive of the RBH Royal Berkshire Hospital, Steve McManus, appreciate your time. Thank you.